this is a study that established that you need about 6 grams of xylitol per day to reduce cavity-causing bacteria. And the best results come from not getting it all at once, but spreading it across multiple uses throughout the day. This was done by Peter Milgram and researchers at the University of Washington. And they were looking at xylitol research, and they said, hey, sometimes we give people xylitol gum and we see incredible results. And sometimes we give people xylitol gum and we don't see significant results. What gives? And he looked at this and he did something that was similar to what I did when I first started looking at this. He said, well, there's a dosage threshold that we need to establish. We need to make sense what's the right dose. So he gave 3 different groups, different quantities of xylitol throughout the day, all in a gum format. There was one group of patients that consumed 3.44 grams of xylitol, one that consumed 6.88 grams of xylitol, and one that consumed, I think, 10.22 grams of xylitol. And he compared those groups and he looked at the strep mutan levels in their saliva and in their plaque. And he said, I'm going to look at them at baseline, I'm going to look at them at 5 weeks, and I'm going to look at them at 6 months. We're going to see how the levels of strep mutans change in their mouth by group. The ones that got 3.44 grams of xylitol didn't see a meaningful reduction in their strep mutans levels. But if they got 6.88 or the 10.22 grams of xylitol, they saw a 10x reduction at 6 months in the levels of strep mutans in their plaque. The plaque is that nasty, it's that stuff that lives on your teeth that's all sticky. It provides a home for bacteria, but it catches food particles where those bacteria can consume them and turn them into acid. So when you cut down on the strep mutans in plaque, you get less plaque, but what you really get, less acid, less decay. Xylitol becomes a really useful tool to use if you can get the right product. But not all xylitol products are created equal. You want to check the label. I have a specific recommendation when you're looking for these. If they tell you the quantity of xylitol, that's a really good sign, because then you can calculate what does it take for me to get to my 6 grams a day. If they're not telling you the quantity of xylitol that's in the product, there's a good chance there's not enough of it to really make a difference.